We are with Dr. Varinder Kaur, the in charge and SMO of the gynae wing at the Civil Hospital in Jalandhar, who will tell us about the magnitude of the patients at the hospital. The Civil Hospital Jalandhar is one of the busiest maternity units in the state, and it averages an OPD and deliveries of 400 to 500, and at times up to 550 a month. So she will tell us about the prevalence of the staff and the challenges and triumphs that the staff faces at the Civil Hospital Jalandhar. So, ma'am, currently this month, how in January 2026, how many deliveries did you have in a month?
We conducted 451 deliveries, and out of which 192 was the C-section, and out of which 74 C-section they were performed during night.
Right.
And 282 around we had normal vaginal deliveries.
Right. Right.
Yes.
And at night, the staff shifts, do you face any challenges or do you have adequate staff to conduct, especially the challenging services which come in at all hours?
Like civil hospital in MCS centers, we are having 8 staff nurses in the labor room. We have sanction post of 4 medical officers, and which all are filled. And we are having blood bank, which is a backbone of our MCH. Like we can get emergency blood anytime. And we have backup of surgeon also. And as a team, we are doing very good work.
What is the frequency of transfusions that expecting mothers need?
In this month, we had 46 transfusion. And if the patient is at term, then we like to go for the blood transfusion if HB is less than 7.5, 10%.
Right.
And if in the early trimester or in the early pregnancy, we try to do the oral iron or injectable iron. But if the patient HB is less than 7.5, then we go for the blood transfusion.
Your per day deliveries range usually from average of per day deliveries?
10 to 12.
10 to 12. So, given the magnitude of the work that the staff at the Civil Hospital is facing in the maternity wing, so you have conducted recently some very challenging surgeries as well. Please tell us about them.
In last week, on 3rd of the Feb, we had a patient. She was 4th gravida. The 4th child was there, and previous 3 deliveries. One of them was cesarean delivery. On our ultrasound, placenta was not low lying. It was bilobed placenta. They just report was not. Patient was 6.5 grams when she was admitted. We did blood transfusion.
The hemoglobin.
HB. HB was 6.5, and patient went into the labor, and we did emergency cesarean for that. During cesarean, the placenta was attached to the lower segment. It was low-lying placenta accreta. So in that case, the patient, she bled profusely on OT table. We resuscitated the patient. Blood transfusion was done, and we called the surgeon, and the hysterectomy was done for that patient, and we saved the life of the patient. It was a difficult case, which is being done in we try to refer this patient to the medical colleges.
Across several hospitals in the state. What is the frequency of such kind of incidents?
This was done during emergency, but in case of previous cesarean with the low-lying placenta, we go for whether this is accreta or percreta, or if the patient or if it is posterior placenta and previous cesarean, then we conduct the delivery here. But in case of accreta, or when the placenta is attached to the uterine wall, it is embedded into this, then we refer the patient to the medical college, tertiary care center.
Is that a possibility?
Then we did this case. Then it's a difficult case. We did it, and we saved the life of the patient.
So you usually is there a need for referrals per month from the civil hospital? Are there cases complicated enough to be referred to, say, the Amritsar Medical College?
Yeah, there are some. So there is a tertiary care in the medical college. So some cases we have to refer. This is a secondary care.
Right.
We do whatever we can do, but some of the very sick patients, then we need.
And then finally, in this region, for the longest of times so far as we've been covering maternity, maternity care, anemia and hypertension are one of the very common problems. So what is the reason for that? As a veteran doctor, what do you think?
Anemia, it is mostly the nutritional anemia which we are encountering, and especially in cases of the migrant population
Migrant
which we are
population.
catering. And in Punjabis, I see that the Punjabi females, they suffer more from the medical causes, medical ailments, like they are having GTM, gestational diabetes, or PIH. They are elderly priming gravida. They are having more prevalence of this PIH, pregnancy-induced hypertension, in these cases.
Okay. And finally, what would your advice be for maternal care? What are the key factors that you would advise families and caretakers to
Proper,
focus on?
every pregnancy should be planned, and every delivery it should be celebrated. And during pregnancy, we have to take the advice of consultant or gynecologist specialist, not for a simple BAMS or like layman. We should at least a gynecologist should examine uh, during pregnancy that patient, and proper monitoring of BP, sugar level, all investigation should be done, thyroid profile should be checked, and all precautions should be taken, and healthy diet, activity, antenatal exercises, and postnatal exercises, all these should be done.